pregnancy, abdominal distension, and C-section. So we'll start with pregnancy. Women have a unique ability to have this like lengthening in their abdominals, obviously due to the stomach growing outwardly. So that abdominal wall has to be able to lengthen in order for that fetus to be able to grow within that uterus area, right? So that unique ability is awesome for that. But in the case that, say, post-birth, if you don't actually strengthen your core correctly, with like a lot of people have heard of pelvic floor training or physiotherapists that specialize in that, if you haven't gone through the works to actually bring those muscles back to the proper length tension relationship, this can cause a lot of dysfunction over time. And if your pelvic floor is dysfunctional and not responding or strong enough, then you're going to have a really hard time trying to actually engage other really important areas in your body because your pelvis is not in the ideal position. So that's pregnancy in a nutshell, which again is going to make you more likely to experience lower back pain and discomfort and potentially issues in that low back and knee region. If we're talking about abdominal distension, that's where the abdominal walls are kind of like they're protruding outwards, but there's also a condition called rectus diastasis, which is an actual separation in the middle of the abdominal wall that you could fall victim to if, again, not addressed correctly post-pregnancy. And not all women experience this, but some of them do, where you actually have to rehab with specific core training exercises to be able to actually close that gap. And it's like a 3-finger test that you would do right in the middle of your abdominals. That would, if there's a gap more than 3 fingers between the left and the right side of the rectus abdominals, then you would check you would have that condition. So that's another thing or a hypothetical potential that could really cause some lower back pain discomfort. Third is C-section. So obviously that's where there's an actual incision on the abdominal wall where your abdominal walls are actually cut. And so that can cause a lot of potentially like scar tissue that needs to work out, obviously core dysfunction because that area or that tissue has completely been severed. So again, it just takes very specific core training to be able to recover from such a thing. So generally speaking, if we're talking about these 3 things, all of them could potentially lead to or be the cause of why those abdominals are not feeling like you can, one, really contract them, or potentially they just haven't had enough time and attention to actually be strong enough and intact so that you don't have this lower back pain, discomfort, or irritation.